Well, hey, good evening, everyone. How's everybody doing? Uh, Want to say good evening. Want to welcome you to this year's 2021 um, INE Day. On behalf of the In-Game Center, we just want to welcome you. We're excited that you're here. And we really felt that having a town hall would be a great way to kick off the event. Um, and I got to tell you, I'm excited. I'm honored to be entrusted with the responsibility to move things along this evening. And in an effort to be more inclusive and to expand the reach of the tobacco control community, we wanted to do an event in the evening. We wanted to do that so that more people could attend. We wanted to invite more community partners to the table and really expand our reach. And so we're here. I want to go to the next slide if we can. I'm not seeing it. Okay, there we are. I see it now. So I want to talk a little bit about the Tobacco In-Game Center. At the center, we do three things. We provide technical assistance. We provide resources and community organizing to support the community engagement needs of California's tobacco control community. And our team, we also provide one-on-one consultation and technical assistance on community organizing. So if you need things like help with your Midwest Academy strategy chart, decision maker matrix, circles of influence, or if you just need to coach your coalition members to polish their storytelling skills, we're here for you. We're here for you. We also have our website where you can look at recorded webinars or just join us for a monthly affinity calls that take place on the second Thursday of every month at 1 p.m. So again, we have affinity calls second Thursday of every month at 1 p.m. Next, I just want to take a minute quickly and acknowledge our fabulous team. You'll see them on the slide. I'm going to go through quickly. Laura King, our principal investigator, Paul Neprath, our director. You'll see Christian and Toki, who are our organizing and engagement managers. Amber, who's our field media advocacy manager. Maya, our operations manager. Sarah, project controller. Jamie, our government relations lead. And finally, Jackie, our digital strategy director. And we also want to take a moment and just acknowledge and thank our friends at the California Tobacco Control Program. Too many to name, but just appreciate each and every one of you and all that you do. Also want to acknowledge our work group members that you'll see here. These are the individuals that really helped to shape the town hall. You know, they're the team that took the time to make this happen and really put together an experience that we thought, you, the audience, will enjoy. So I'm going to pause just for a second. I'm not going to call out the names, but give you a chance just to look at them. And if you can, drop them a note in the comments. Thank them for the hard work that they did. All right, let's keep moving here. So I want to talk on this next slide a little bit about the town hall. And again, you'll see there, this is really to kick off the INE Day. And as I mentioned earlier, we're really doing this as a way to expand the reach of the tobacco control community, bring more partners to the table, and provide more access. So we're really excited, and I see the comments in. Yes, thank you. Work group members are amazing. Thank you for putting together such a great event. On the next, I want to talk a little bit about, kind of when you think about tobacco as a social justice issue, I think we got to look bigger than this. And when you think about change, change in this country has always been a result of people speaking up against injustices. We got to work on policies that could keep our communities safe and keep them healthy. And if you think about the national dialogue right now, it's really focused on holding those accountable who abuse and harm our communities. And that includes big tobacco. So we got to continue to work on policies to keep our communities safe and keep our communities healthy. And, the time now is to put an end to things like police violence and brutality in our communities. And I use the word "and" because that "and" is very important. We've got to be focused on, some of the biggest things facing our communities and preventing a new generation of smokers from emerging. There's an and there that's really important. And while we're at it, we can't be mad about these injustices and not also care about injustices like what we witnessed in Atlanta a few weeks ago. I mean, it's all, these are all tragedies, and we've got to be equally concerned about all of them. And so it's important that we continue to engage in constructive dialogue and work to ensure that opportunities like these are met with truly impactful changes. I'm sure many of you saw last week, the U.S. Centers for Disease Control and Prevention and CDC Director Walensky issued a statement declaring racism a serious public health threat. And I like one of the quotes that she used. It said, "To build a healthier America for all, we must confront the systems and policies that have resulted in the generational injustice that has given rise to racial and ethnic health equities." And with tonight's town hall, we really have the opportunity to shine a light on the role that big tobacco has played with its predatory marketing practices. And as we continue to confront racial and ethnic health disparities, we must also continue with our tobacco control fight. Last year, you'll see on the next slide, Kareem Abdul-Jabbar, Laker legend, and I'm an LA guy. The Lakers are my team. Really excited, hoping that they repeat as champions. So those of you, if you agree with me in the comments, put a happy face, a thumbs up. But Kareem wrote an article in the LA Times, and he referred to racism as being like dust in the air. And I love the quote, because what Kareem said is that it seems invisible even if you're choking on it until you let the sun in, and then you see it everywhere. And as I think about tonight's town hall and why we are talking about tobacco as a social justice issue, the way that the tobacco industry targets our communities and our kids, it's like dust in the air. It isn't always visible until you shine a light on it, and then you start to see it everywhere. And panelists, I want you to think about that, because in a little bit, I want to get into a question. How do we shine a light in the predatory practices of the tobacco industry? Now, it's interesting because Kareem ended the article by saying, as long as we keep shining that light, we have a chance of clearing the air wherever it lands. But we have to stay vigilant because it's always in the air. And in our fight against the tobacco industry, against commercial tobacco, we got to stay vigilant. And I think that's the moment we have right here. Not only do we have the opportunity to shine a light on things like, structural racism, but we also have an opportunity to shine a light on the way that the tobacco industry markets its products, the way they target communities, and the way they try to hook our kids. We have an opportunity to shine a light on those things and work together toward meaningful change. I want to do something else before we get into the panelists. You'll see a map on the next slide, and this is something that we thought was very important. For those of you that aren't familiar, land acknowledgements are a simple but a very powerful way to show respect to the original inhabitants of the land where you are currently standing, presenting, about to engage in an activity, where you're on this Zoom tonight, right now. It's a way to show respect. And, this isn't just an exercise for us. We're really hoping to inspire you to take action to support Indigenous communities. This is a meaningful step toward honoring the truth, making the invisible visible, and correcting the American stories that erase Indigenous peoples' tribal history and culture. So tonight, we really want to take a moment and acknowledge and create an awareness of Indigenous presence and land rights. So I want to ask you all, take a moment to look at the map and identify the native lands that you reside on, and just put it in the chat. All right, I see it coming in. And also want to stress that this is just a starting point. Really want you to ask yourself, how do you plan to take action to support Native communities? And I just want to say that, I join you today from Tongva land. I recognize that we are on stolen land, and I extend my gratitude to the many Indigenous peoples who have rich histories here. I commit to recognizing, supporting, and advocating for the sovereignty of the Indigenous nations. And I pay respect to the elders past and present, acknowledge the truth of violence perpetuated in the name of this country, and make a commitment to uncovering that truth. And so thank you. I see so much coming in on the comments. You'll see on the next slide our esteemed panel. And if you click on the link, you can read their bios. They're all so accomplished, so incredible. We're not going to read through their bios tonight, but please take the time to do that. We can also get you their contact information if you want to follow up on anything that they may have said during the panel. And so now it's showtime, folks. So let me know in the comments. Are you ready? I need to hear from you. Are you ready to get into this panel? All right. So the first thing I want to do is ask the panelists just to take a moment and kind of share a little bit, about yourself, how you came to do this work, and maybe one thing that isn't in your bio in terms of something that you're really proud of, an accomplishment that you had. And in the interest of time, I'm going to call on you to introduce yourselves. And so let's start with Jackie. Jackie, good evening. Tell us a little bit about yourself and the work you do.
Thank you so much, Eric, for the welcome. My name is Jackie Caslow. I am the Interim Executive Director of the Native Star Foundation. I'm also the Project Director for the Red Medicine Tobacco Prevention Project. My pronouns are she, her, hers. And I want to mention that I am a direct descendant of the Ione Band of Miwok Indians. I also have direct familial affiliation with the Pit River Nation and the Nishnawin-Maidu tribes. I've been working in tobacco for about a little over 10 years. So relative to this panel, I'm pretty much a newbie, but most of my tobacco work has been with tribal communities in the past. So now I'm a little bit more mainstream, along with a nice cohort of other tribal grantees. So I'm proud and happy to be joining you this evening.
Reverend Sauls.
Good evening. Thank you, Eric. So good to be here with everybody, and just glad to be here, representing community health councils and Amplify. I was born and raised in South Africa, and my mom was a smoker. And of course, then I was not aware of the impact, around smoking, until I came to San Francisco in 1996. And then connected there with Cal Magruder and the African American Tobacco Control Council, and we started looking at you mentioned the predatory, practices of tobacco. Really began to educate myself as one who always seek to look for the intersection between faith and health, to really then realize the deceptive, destructive, and manipulative strategies, of tobacco. And now, continuing that work here in South Los Angeles, working around unity and solidarity between Black and Brown communities, and to really see, how we can continue to facilitate the health and safety, of our Black and Brown communities. And just, enjoying that. And, with that, living at the intersection of South Los Angeles and South Africa.
Thank you so much. Elisa, let's hear from you.
Hey everyone, I'm Elisa Tong, pronouns she, her, hers. And I'm a native Californian, been here in Sacramento, born and raised. And what I do now is I practice medicine, but also have been doing research on tobacco control policy and cessation work for, quite a time, 20 years or so. And now project director of California Quits, which works on health systems change for tobacco treatment, especially focused on low-income Medi-Cal populations. But the way I got started on tobacco control, when I was a med student, I was interested in healthcare reform. Already I didn't really realize what social justice, public health was at the time, but knew the more I learned about tobacco control, the more I needed to do something. I was also interested in Asian health at the time. So very lucky that I was able to stop out for a couple years from med school and work with some great mentors at UCSF. And I learned all about what the tobacco industry was doing, looking at their documents. Learned a lot from Appeal. I see Rod Lou's on as well, and about more about the Asian American Pacific Islander community, learned more about the other communities, priority populations working on tobacco control. So yeah, I got bit by the bug back then, and I'm still working and still learning from everybody, including Jackie, who's taught me a lot about American Indians and tobacco control as well. So happy to be here.
Thank you so much. Isaias, let's hear from you.
Hi, everyone. My name is Isaias Guzman, and my pronouns are he, him, and his. I am the organizer for the California LGBTQ Health and Human Services Network. And I've been doing, I've been in the tobacco control world for about 2 years now. So if Jackie's a newbie, I'm a novice. My primary work has been around advocacy and organizing with young people and queer and trans people. So a lot of my work has delved into sexual health and HIV curriculum and working with young people to empower themselves to become their own agents of change. And so through that type of work, I've always been committed to health equity and health justice. And that's how I got into tobacco control work, because there's always an interconnection of making sure that, you know, if you're addressing the societal injustices and the structures that enable discrimination, there's always a way you can do to combat it, either through tobacco control or another avenue.
All right, thank you. Kristina, let's hear from you.
Hi there, I'm Kristina Herrera, pronoun she, her, hers, and I am the project director for tobacco control here in Tuolumne County. I have been in tobacco control for almost 10 years now, so I still feel relatively new. I'm still right there with Jackie, and very humbled to be presenting with our fellow panelists today to kind of speak to the rural perspective. Tuolumne County is a rural county, and many counties in Tuolumne, and so I grew up here. I actually came here from the Philippines when I was young and grew up in a rural community where I didn't look like anyone and couldn't wait to leave after high school and college, and found my way back here in Tuolumne County and realized that there's a lot of work to be done here, and that I'm lucky to be able to use the skill sets I learned through my schooling and the ability to have been able to go do that and bring it back here to kind of bridge some health equity issues that rural people experience. While we don't have some of the diversity, there's a lot of gaps we need to address with social determinants of health and a lot of awareness. And so I am happy to be serving my community here and representing rural issues on this panel.
Thank you so much. And last but certainly not least, Lourdes.
Thank you. Good evening, everybody. I'm Lourdes Baezconde-Garbanati. My pronouns are ella, she, her, and hers. And I am also part of the Hispanic Latino Coordinating Center on Tobacco in partnership with the California Health Collaborative. And so I welcome all of you who are here today. My history in tobacco goes way back, probably longer than many of you have when you guys were barely born. So I've been in tobacco control for over 30 years. And my journey started in a very personal way. My grandmother died of emphysema, and I watched her in that time as she just gasping for air. And it was very tragic and left a mark in me. And when I came to the United States, I began to notice these disparities, which I couldn't explain. I didn't know exactly what they were called, but I knew that my family were all suffering from tobacco-related diseases. My uncles, my aunts, everybody smoked. And I could see in my husband's family, who were white, that their outcomes were much better. The diseases were not the same. And somehow they had received education that I didn't see my family have. And so that fueled a passion for tobacco control and cancer disparities, which still is very vivid in me today. So I am really happy to be here and glad to see not just some of the old folks that have been with me for a long, long journey, including Elisa and Rod and others, but also all of this new generation. So thank you for being here tonight.
Thank you all for that. So we're going to get into some of the panel discussion questions, and then in a little bit, we will open it up for questions from the audience. And so I want to open us up with this first question. And again, I want to frame it around, we're talking about tobacco control as a social justice issue. And so the first question is, with all these issues going on in our community right now, why is tobacco control still relevant, and why should we focus on this mission? Who wants to get us started? All right, panelists.
I'll start.
All right. We'll go to Lourdes and then
Okay, sure.
Reverend Sauls.
Probably having had a long history with tobacco, I think it's really relevant to us even today. And today, in the time of COVID and the pandemic that we're living, we have seen the disparities even more exacerbated in our Black and white community, Black and brown community, and also with our Asian communities. And so I think that tobacco is still a big issue in our community. We're still fighting the tobacco industry in many, many ways, with the clever ways in which they continue to advertise and really lure the different communities to a life of addiction, whether it's now with flavors or vaping, and just new ways of doing that. And now with the combination of cannabis, some of the work that we're doing at through the Health Collaborative, and especially at USC, we're really seeing sort of new ways of approaching this whole issue of tobacco and addiction in our communities. And I think that, a lot of people don't understand still some of the dangers of tobacco, and especially in combination with other products. And the industry still cares about its profits mainly, and advertising to our communities in a very targeted way. And it's just that the ways have changed now with social media and other things. And I've always said we need to keep, a few steps ahead of the industry, and that's where it's really critical, all the work that everyone is doing.
Yeah. Thanks for that question, Eric. I think, I want to just start off by mentioning two words, that is intersectionality and equity. I think for me, bridging those two words makes what we need to do about the impact of tobacco, especially, on, Black, Indigenous, people of color, still at the forefront, in terms of that. And so having said that, we need to be clear that I believe, tobacco was introduced as a crop in the United States around, I think, 1617 or so. And then, by 1619, thereabouts, I believe it was one of the most profitable crops, then. Well, guess what happened, in 1619? Our ancestors arrived, here. And clearly, the plantation, or the plantations in Virginia, was one of their destinations, for labor. And so, tobacco is an integral part, of, how not just capitalism, but racial capitalism work in the United States. And then with that, then comes the fact that, tobacco is not just a social justice issue. I want to push it even further by saying it's a racial justice issue, because it is still, the number one killer, of African Americans. And one thing that we just have to be clear about is before the pandemic, there was an epidemic, right? And this epidemic, it, directly, affected the respiratory system, right, of, Black and brown communities, and other communities of color. So consequently, there is just this ongoing, manipulation, deception, and destruction that goes on. And then when you connect all of that now, not just with, programs for prevention and intervention, but you now connect that with programs and policy, we then see how integral, tobacco has then worked around. Yes, we celebrated President Obama signing, right? You see that law, into effect around tobacco control. But guess what? There was an exception of a mental because, of, that manipulation that has gone on in the African American community. And as a person of faith, how sad it is that in so many ways, the faith community, has joined in so many ways with tobacco, in spreading, the deception and the lies. And so, so it brings it front and center, around still how there are so many racial connotations, placed on, tobacco flavors and otherwise, as we look at this. So it is still relevant, it is still real. And as we make our way out of this pandemic, we will still be in the epidemic, of, those comorbidities that we have to deal with, as we work towards, racial equity.
Such good points. So again, Jackie, were you going to jump in?
If I could follow Reverend Sauls, I would so appreciate it. I seem to have a habit of following Reverend Sauls. He really inspires me to bring in my voice. So if that's okay with you, unless if you had a thought that you wanted to complete first. Okay, well, thank you. I'm very much inspired about hearing the perspective of somebody who looks at the intersectionality of race and social justice with history and policy. And for me, it's really important to mention that for Indigenous people, for Native peoples in the United States and the Americas in general, this issue is both relevant because of the extraordinary disparities, smoking disparities that we see in the data today, but also from a historical perspective. And I have shared with many people who are close to me and the communities that we work with, that for me, it's very much a social justice issue, because the big tobacco and this industry has been appropriating, exploiting, and corrupting something that is considered a traditional sacred medicine for many Indigenous peoples. So not only have they put something that was important to Native culture and Native values under the transition of being a commodity that's turned into a product that kills and harms people globally, but they've also taken our cultural values and they have distorted them in a way that collapses into and intersects with the social determinants that we see in the environment today. So when we look at communities of color, we see lots of different health disparities that are afflicting these communities. And it behooves us not to reach back and look at the historical setting that has gotten us to where we are here today. And so with the Native communities that I work with, we're trying to land our efforts in disentangling and separating commercial from traditional tobacco as a starting point. And the way that we're doing it is we're talking about some of the policies that Reverend Sauls mentioned. We're looking back at what are the policies that have been put into place that have resulted in harms to Native communities. Policies such as the outlawing of American Indian religious freedoms, policies of genocide, policies of displacement and taking of tribal lands. All of these things have resulted in communities who have had tremendous challenge, as do other communities, with historical trauma. And this historical trauma is lending itself to addiction, to self-medicating, to all sorts of problems that we see leaves an opening for the tobacco industry to become a dependent product for these communities who are struggling with trauma. So for us, working in the tribal communities, it really is an issue of policy and how do we stop the tobacco industry for addicting a new generation of our youth, but it's also reclaiming our traditional values, reclaiming our traditions, and removing ourselves from that sort of exploitative process. And I do believe that policy will help us get there to a future where, the revitalization of these communities, which we've seen in our political landscape in the last year, not just in COVID, but also just across the country with the Black Lives Matter movement and with other initiatives, it gives some inspiration and some grounding for some of these discussions that we're having with this panel today. Thank you.
Thank you. Oh, go ahead.
Yeah, so let me just add to that, those great conversations. Let me tell you why tobacco is a social justice issue in the LGBTQ community. Today, if a child comes out as gay or transgender, over 60% of them receive a negative reaction from their parents or are even kicked out of their homes. And after being kicked out of their homes, they end up either in the foster care system or they end up in the streets. We have data that shows, at least in Los Angeles, that over 40% of homeless youth identify as LGBTQ. And we have evidence to show that in the foster care system, there is discrimination against LGBTQ foster young people. And so our LGBTQ youth are looking for places that are safe. So they then in turn go into their schools to find community, to find peers. And evidence shows there that there's discrimination and harassment and bullying from other students against LGBTQ people. And sometimes even the policies at schools are anti-trans, anti-gender expression, right? And so what do they have left? Substance use. They have substance use like drinking alcohol or using tobacco. And these different types of substances become ways to create community between LGBTQ people, either in the streets or at clubs. So smoking becomes a fabric of our community. And that's why it's a social justice issue, because it becomes so integrated that we cannot disconnect our identities from these types of substances. And we can't understand being queer or trans without smoking with our friends or surviving without them. And this is why it's something that we have to be talking about today and right now.
Excellent points. Excellent points. Anyone else want to get in on this question?
I'll add everyone covered a lot of really good topics. And as I listen to them, I see a common thread of no matter kind of what population you're working with, the tobacco industry is really seeking to find our most vulnerable populations. And in rural communities, I think the biggest tactic they're using is entrenching kind of the idea of tobacco use as one of the values of people who live in rural settings, and really going for those who don't make as much money, who have not gotten the opportunity to further their education. And the data shows that our tobacco use rates in these rural areas are higher in certain subgroups, and those who may not make a living wage, who don't have beyond a high school education, are the ones who are most heavily marketed to. And so I echo what my fellow panelists say about that tactic of making tobacco seem like it is part of the culture or part of the environment, which it is not. And so there's a lot of work to be done in policy and program and outreach to reverse the successful marketing this industry has had. And so I will share that it is not a value that is shared, but is perpetuated by the tobacco industry.
All right.
If I may just add one more thing, it's such a stimulating conversation, and agree with everything everyone said. You know, the tobacco industry, has exploited many communities, not just here in the US, but globally. And, as an Asian woman, that was one of my motivations, was realizing, well, that's the open market that they're looking for. And also, there's non-smokers exposed to secondhand smoke. It's not, you can't just blame the person using it. It has an impact on all of the society and life course. But and just like the COVID virus, the tobacco industry mutates and adapts, and we just have to be on top of it, because we're seeing that happen right now with all the new products that are coming out and targeting a new generation which has no knowledge of what happened before. And so here we go again. We have to educate and empower people, and this is why it's refreshing to see people of all different experiences and backgrounds come together tonight. And one thing that has made that I think about also in this really stressful year with all the different issues that have come up and different communities that have all the different stresses from, but it's like, what do you do with this data, with this knowledge? And even for me, seeing the AAPI community rising up and taking action and saying, here's data, and here's what we're going to do with it, and here's what we're going to advocate for our communities. I see the same things in tobacco control, and I'm seeing the same things on other issues now. And, someone brought up intersectionality, but it's a lot of these common threads, that affect the health and well-being of our communities.
Thank you. All excellent answers. You guys are just really hitting it out of the park. Want to go to another question, and you guys started to go down this road, so I want to take us a little bit further. So, we've talked about some of the social justice issues that we're dealing with right now, and the current pandemic has really, shined a light on. And then we look at that next to health justice issues, and so let's talk about health justice a little bit more and its relation to social justice. Who wants to get us started off there? I see some heads nodding. I see some folks about to come off mute. Let's hear from you on that.
Well, I can take a first stab, and maybe Jackie will follow because she helped stand up California Quits. I've never been excited about insurance, but once I realized that Medi-Cal covers 1 in 3 Californians, and my colleagues, Shu Hong down at UC San Diego, did an analysis showing, 40% of our smokers in California, which is still almost 3 million, are covered by Medi-Cal. And realizing, hey, how is our healthcare institutions serving, the people that they're supposed to? And I think that's one reason how things kind of came to being from, hey, the Affordable Care Act is opening up, doors for how we should be prioritizing, prevention and tobacco treatment. And, that was just a first step. And what should we be doing to run with this? And how do we bring it up from not just the person, at an individual level, at least for me, seeing the patient in front of me, but how do we bring it up to a systems level? And how do we get this changed in the infrastructure so that we're tracking data and we're, able to share data, and then systems are held accountable for health. And I think we're finally getting to a point where we're starting to see some of that. It's slow to come, but even for Medi-Cal right now, they're talking about having public hospital systems do required projects on improving health equity and start looking at their data and trying to work to improve it. Now, do they need help? They certainly need help with how to address communities, but I think it's a start. And fixing things that could have been fixed way a long time ago, but now the stars are aligning a little bit more.
All right, thank you. Jackie.
Thank you for those comments, Eliza. I think, for me, I'd like to share that when I joined Eliza's team a couple of years ago, it was so striking to me to look at the data and ask yourself the question, who smokes today? And when you see that it is overwhelming people of lower socioeconomic status, people in poverty, people with mental health challenges, people who have other co-occurring addictions, people of color, we've touched on the people of color and people in marginalized groups, but also just that it is a problem that has been entrenched in communities where you can look at it from one dimension and see that it's largely underprivileged people, but you can look at it from another dimension, which is these are the people who suffer from housing insecurity, employment insecurity, lack of coverage of medical insurance, as Eliza alluded to, and other, a whole conundrum or a whole bunch of different social determinants. And so you have to ask yourself what's going on there. For me, it's not just a question of education. Everybody knows that smoking harms you. Everybody knows that it's something you should try to quit. So it begs the question, what do we need to do to help people to move beyond the addiction of smoking? And then we have to work with our community partners to understand that there are people out there in organizations who know these communities, who work with them closely, and through those partnerships, we can strengthen the way that we address the issue And then just as Elisa said, there's preparation of the systems to better support people in their processes of getting tobacco treatment. So, you know, for me, it's really, it's a failure if we do not address this issue for the most vulnerable populations. And several of my panel members have mentioned that. But if we don't address it as not the forgotten group, because the tobacco industry certainly hasn't forgotten, and they continue to target and do all sorts of clever things to get people addicted and expand their markets. So for me, the social justice part is that we can't let underprivileged people or people who've struggled with so many different things continue to struggle without support with this particular addiction.
Yes. Yes. Reverend Sauls.
Yeah, thanks for that question, Eric. And yeah, I think it really, the question, you know, invites me to, you know, throw into the pot the other eye that guides how I do what I do. You know, so in addition to intersectionality, there's the whole piece about intentionality, right? We are not where we are as it relates to health inequities by accident. We are where we are as it relates to health inequities intentionally, right? It's planned, it was strategized, and therefore institutionalized and systematized, you see. And so because of that, we create then, you know, a population that is marginalized and therefore neglected. And then we do not provide them, you know, of course, before that, we judge them, right? And stigmatize them, right? And then we don't provide various ways or programs or strategies for them to deal with the stresses of the trauma that they are experiencing. And so the most, and then you make accessible now, right? You know, sometimes the one or two, you know, products, you know, that they have access to kind of deal with the trauma that they are from the systemic, you know, health inequities, you know, and many times, of course, you know, tobacco is one of them, you know, hence, you know, we're dealing with how flavor has impacted, you see, you know, the lives of, you know, our sisters and brothers, you know, in terms of that. So we cannot, you know, forget that health inequity is it's built into the DNA of the United States, right? And we need to call it what it is. It's an integral part of the big lie that has facilitated the destruction of Black, Indigenous people of color. And so we have to be very intentional in how we analyze it, and very intentional in how we act upon strategic ways to then move us towards health equity, you know, as we, you know, work, you know, towards this. And so for us, you know, in South LA, given the trauma that our folk, you know, are dealing with, when we had a town hall once through our Healthy Kids Zone, you know, project that we do in South Los Angeles, that is very intergenerational, you know, and smoking and all that is part of it. You know, we heard from folks saying that, you know, sometimes the reason why I don't quit is because I feel like people are condemning me, right? And so we covenant to have a commitment to, you know, no judgment, right? And to really see how we can connect cessation and compassion, you know, as a way of saying, hey, we in this with you, and let's now see how we can deal with the systemic challenges, programmatic ways that can move us, you know, towards, you know, healthy, you know, choices to deal with the trauma, because it's real. It's real. But, you know, it's very intentional, and we've got to be intentional, around us, and as you mentioned about Karim, and shine the light on it, as we make our way beyond it.
Eric?
Yes, Lourdes.
So I wanted to add, I agree with my fellow panelists and all of the comments made, but I also want to add there are two things in particular for our communities that we're facing right now. And this is, sort of like the fact that we are experiencing what we're calling an infodemic as well, which is an epidemic of information, and much of it false information. And so in that sense, this has been the most trying times in the last few years, where that has just flourished in a way that we had never ever seen before. And that type of information is really detrimental in many of our communities. I know in particular, some of our communities, especially Latino communities, that get information not just from the United States, but also information that's coming from Latin America. I mean, I have a WhatsApp with just my family from Latin America, and the kinds of things that come up are just incredible. And I think that that's where the role that the community-based organizations need to really come in to shed light and to really take the reins about what is accurate information for our communities. I think that that in part has fueled some of the fears and issues that we experience with our undocumented communities in the Latino community in particular, where many of them are afraid to access services because of fear of becoming a public charge or other. And, the percentage of Hispanics that overall smoke in terms of percentage don't sound like they're huge, because it's about 10%, smoking in California among Latinos, but that adds up to over 1 million people. And so, in our population, about nearly 1 in 10 California is an undocumented immigrant. And so being able to provide messaging that's culturally specific, messaging that's going to really prevent from creating more fear in these communities if they access any services, whether it's cessation services or even medical, or other services, unless they have an emergency because of these fears. And so I think that tobacco is still, the #1 preventable cause of death and disease. And with COVID now, what we have seen is that, the Black and the Latino communities have suffered a really very large number of cases, as well as hospitalizations and deaths. And so there's still a lot of information that needs to get to our communities, and our community organizations, I think, acting at a local level. For me, everything is still local. It goes up to the, statewide, and then federal, and then worldwide. And that's what we experienced with tobacco control at the beginning. And I think that that's the value of our community-based organizations that are engaged in tobacco control, that need to be there as a sane and voice of reason for all of our communities.
Yes. Anybody else want to? Oh, go ahead.
Yeah, to add to the great conversations, when I think about house justice, I think about accessibility and affordability. And to go even deeper on the accessibility portion, I think about cultural competency, right? And as all of the panelists can agree, we need cultural competent program and cessation services for our community so they can be able to actually access it and feel safe and comfortable in accessing these services. And even beyond just cessation, I think every other aspect of our healthcare should be culturally competent. It's something that our communities, especially LGBTQ communities, have problems with whenever trying to access doctors who are competent in treating and working with LGBTQ individuals, or psychologists who have expertise with LGBTQ people in the coming out process, or LGBTQ people of color. There's a lot of work to be done to achieve health justice, and tobacco is a part of that conversation. And we need to really think about how can we bring in people who have not been in tobacco, our community-based organizations who work with our communities but are not experts in tobacco, to help us create that bridge and create those conversations where it hasn't been at the front, where tobacco hasn't been at the front center of conversations for many of our community-based organizations. But I think that we need to start developing those relationships.
Yes, excellent, excellent points. Anybody else want to grab last point here, an additional point? Reverend Sauls, I see you coming off mute.
I just wanted to affirm, Isaias, in really providing for us a broadened definition and understanding of cultural competency, right? That it's not just about ethnicity, right? It is about sexuality. It is about, even Kristina being here, right? Representing our rural community. It is about, socioeconomic, so all of it, comes into what we talk about when we talk about, dealing with this, or even in our cessation programs. For it, when we say it has to be culturally relevant, we're talking about culture that's not just ethnicity, but culture that is, a socioeconomic status, that's region, and that is sexuality, et cetera, et cetera. So thanks for that, because I think that's a very, very important, point for us to come to terms with.
Eric, can I add just one last?
Yes, please. And I think Lourdes may have come off mute after you.
Yeah, I also want to add that political status, when I think about tribes and tribal sovereignty, a lot of people don't understand that difference with the political status of American Indians as with respect to the U.S. Constitution and their status, and understanding and being competent in that dimension is also very, very important, and promotes understanding of greater problems with tribal communities, especially around tobacco.
All right, final thoughts. Lourdes, did you have?
Yeah, I wanted to talk a little bit about how it's so critical for us to come together as a people, all of us, for example, who are here. I keep thinking back about our ADEPT coalition. And through that coalition, we pretty much are the voice as well for each other. So sometimes we are in places where others cannot be. And so we have this incredible responsibility to at least say, you need to bring somebody in from this group or that group. And I really appreciate Isaias' words as well, because that, a lot of times the LGBTQ community is the forgotten community. Especially if it depends on what part of the country you're in. Some communities are favored over others. For the Asian community, we tend not to disaggregate their data because it's more convenient to us to see it all together. In the American Indian community, sometimes data doesn't even exist. They don't even collect it. And it's incredibly painful to see that, the urban-rural differences, all of that. And certainly our Black communities and Brown communities have been in this fight for so long, and it's like we're still revisiting the same fight. So one thing is to really encourage these equity types of coalitions and coming together, like in the ADEPT coalition, where we can all really be a voice for each other and really support what each one of us is trying to do individually to really make a difference in our communities, because ultimately we want them to live longer and healthier lives. And that's the place where we're just still not at. And I really hope that when I decide to retire, that I am leaving this place in a little better place, and that includes, better and healthier communities overall. It's just amazing. I think that the times we live now are unique in many ways for us. We had certainly the 60s and the Martin Luther King days, but now I'm just calling on these new voices. There's over almost 180 8 people here. And I'm wondering which of these new voices are going to be our leaders that are going to take us into this new future, because we really need to learn from the past, but really try new ways out in our communities to make a difference.
Mhm. Yeah, Eric, I just want to, I was looking at the chat, and Jennifer in the chat was talking about, intersectionality within groups. So she's giving me a new word called intrasectionality, right? Within our Latinx community, there's intrasectionality. Within our African American community, there's intrasectionality. I'm a Black immigrant, right? Who then build, a bridge with the African American community. So one has to deal with that. I know Elisa, can probably say the same thing in terms of our, Asian sisters and brothers. So it's just an invitation, that it just invites both enlightenment and enrichment, right? That in many, many ways challenges, this whole narrative, of conformity in the United States around that. I mean, Lourdes, I appreciate, your word of infodemic. I was like, whoa, I wrote that down. So, but just, these, different ways in which we, the enrichment that we get from one another, I think provides empowerment. And as we do that, it then allows us, to be each other's teachers and students as we work towards our collective liberation.
Thank you so much for that. We are almost to the next portion of our program. So I want to encourage you, if you've got questions, put them in the chat, because I'm going to ask one more question, and then we're going to go to some of your questions. And this next question, Kristina, get ready. I want to give you the first word on this one. Both Lourdes and Reverend Sauls talked about, talking about, the fight that continued, learning from each other, excuse me. And I think about looking at this screen, and I'm going to be careful, and I'll just say we have decades of experience. I'm not going to say many decades. I'm not going to give myself in trouble, although I think I could add, and I definitely got enough decades for this hand, and maybe enough for this one. But at any rate, if I'm someone who really wants to organize in my community, and again, I want to start with you, Kristina, what does community organizing look like? And maybe you can talk about some of the communities that you've organized for folks that are maybe newer to this issue, to the tobacco control movement. How would someone get started, and how do we do that? I want to give you the first word and then let others follow.
All right, thank you. How does one get started? I try and think about when I got started 9 years ago, working in the community I do, and I just, without more eloquent words, I could just say, just speak up. That's look for things. Just reaching out to community groups that you may not have worked with before. I know in the chat there's things about silos, and I wholeheartedly agree with our funding sometimes does put us in silos. My lane was tobacco control for many, many years, and it wasn't until recently that we started to partner with nutrition, with mental health, opioid prevention programs, our violence prevention. And then you start to see that collective spirit of we're all working kind of towards that same goal of protecting our residents. And so to me, in the rural environment that I've worked in, when I think about what health justice is, I can maybe speak on behalf of some rurals of even saying that in a rural setting may bristle some people, because it's still a term that may not be as familiar with our community. And so to be a good community organizer, you need to know that community. So just rewind a little bit before you speak out, research a little bit, meet the community where they're at. And so whenever I have new staff or we're working with a new agency, we really do a lot of legwork at the beginning to make sure that we as staff are good kind of ambassadors of this message, and that we're not coming in hot with a message that is not sensitive to our population, and meeting them at their literacy level, meeting them at their needs, and just kind of, going with the flow and being flexible. So a community organizer speaks up, they research, they are flexible. So if it means I stay late until 10 o'clock, because that's when that group meets, that's, I will meet them there. I will increase whatever means we have in this community to be more culturally competent. And I will say in rural environments, there is a lot of work to be done in terms of increasing awareness about the issues that my fellow panelists and the groups that they work with. And, just being sensitive to that and educating as much as we can and really promoting our kind of allies messages to our community who may not be familiar with it. And so being that community organizer means putting all of these complex things together and just meeting our community. I can't say it any better than meet them where they're at, listen to them, don't talk at them. Like, we're just here to collect stories and bring those stories, like in your initial, to shed light, to put like the Korean article, put light on these. And that's when our community starts to see what we have in common with Los Angeles and the Bay Area, that we are all seeing these things. We may live in different places, but that collective nature to be healthy and keep our families safe is very shared. And once you tease that apart, I think that's what you gain as a community organizer, is to shed light on those stories and, jump those bridges where we're different and go into the things that we have a common goal. So, and being enthusiastic, that helps.
Kristina, I really love everything that you said. Given that I've been in tobacco control for 2 years, I think it can give a good outsider perspective. And one of the things I've seen is that tobacco control is its own language, really. It's a niche space. It's very new language that people who are new to the space have to learn, the terminology, the words. And so that's usually a barrier that I've seen. And so I would really encourage folks to reach out to people who are not involved in tobacco control, and even those who are not involved in providing health services or programming. There are community-based organizations out there that provide other types of services that might be beneficial to your program, because they're bringing a different perspective and accessing community members who have not been involved or engaged in health spaces. So trying new things, like Kristina said, meeting organizations and stakeholders where they're at. Often community-based organizations are not as well funded, so you're gonna have to see where their capacity's at and tailor those partnerships, keeping that in mind. And so in addition to working with non-traditional community-based organizations, I would always caution tokenizing, right, and tokenism. And to further describe what that means, it can sometimes look like you bringing someone in, but not really having an intentional and sincere relationship with those organizations. It's important to make sure that one person from one community isn't being brought along. Instead, it's better to make sure that you're working with the organization, understanding how they're going to be successful with this within this partnership, and how you're both going to benefit from it. And oftentimes that may mean, offering stipends, incentives, reducing their workload because of their capacity, showing a sincere and honest relationship with these partners, because sometimes community-based organizations can be a bit more skeptical of working with the agencies, because these agencies might have been part of the problem. They might have been part of the historical discrimination against these communities, right? Especially for LGBTQ communities. Our communities are more skeptical of working with the Department of Public Health, right, or the Department of Mental Health, right? They want to see, like, what's our angle, like, where are we coming from, and why are we trying to create this relationship? And so we have to be creating intentional and sincere relationships with them, where we show them that they will be gaining from this partnership as well.
All right, other thoughts?
I wanted to remind everyone that, tobacco control is a movement. And so in that sense, I would like us to kind of think about it in that perspective. It is much broader than just any single one of us or any single one of our organizations. And that community organizing isn't effective without the mobilization that comes with it. And so from day one, when you're out in those communities, It's not just the information we provide, but it also is how we're going to use that information to achieve better outcomes, and how we're going to mobilize those communities so that they in turn can be empowered to reach that level of health that they wish or require. And so reminding folks that you're part of something much broader is really key. And tapping on those resources like Isaias and Kristina have mentioned is critical, with the goal of educating, but also organizing those communities with the purpose of mobilizing when it is necessary so that they can intervene at the local levels in order to achieve the changes that are needed in their own communities. So remembering we are all part of this big movement in tobacco control, and that is key. That's why you're here on INE visits. And I was one of the originators back in the days when these visits began. And I can tell you now it's even more critical for you to be doing this out there, because that is mobilization. That's mobilization of the movement. And you have spent many years, 2 years, 3 years, however many, helping to organize your communities to achieve that goal.
Yes. Reverend Sauls, did you come off mute?
Yeah, I just wanted to, add to what Lourdes mentioned, but I want to just affirm Kristina. So she needs to let me know when she's going to teach the next, community organizing class over there in, Tuolumne County, so that I can get over there and brush up. I thought what you said was just phenomenal. So thanks for that. Yeah, this whole piece around, organizing is key. I mean, my faith tradition, I'm Christian, Protestant, and I'm, I work around Black liberation theology. So for me, the number one thing that Jesus did was Jesus was a community organizer. I mean, we have to just come to terms with that, so before we want to talk about him as savior and, kind of, Lord, all of these, other characteristics, on him. I mean, the number one thing that brother did was he was a community organizer, a human rights organizer. I mean, just look at how he did what he did with the Samaritan woman, etc. So I think that's a key piece. And because of that, I think the proximity is power, and that's where we start. The closer we can get, to frontline communities, those who are directly affected and impacted by this, the better, because that proximity is key and very, very important. And then the other piece around proximity then is visibility. How to then, make those who are affected and impacted visible, because through visibility, one can then receive the vision. So at an organizer, I don't bring the vision, right? I help to incubate and cultivate, the vision. And from that proximity and that visibility now comes the honesty, right? To then see, okay, how do we now, if we're going to tackle this, we got to tackle it from a perspective of truth. And that's the number one piece that we challenge, big tobacco is with truth, because, they have invested into a machinery of deception, right? Around that. And last I checked, scripture teaches me that you will know the truth and the truth will set you free, around that. So Lourdes is correct. This movement that we are part of is a movement guided by truth, and the truth of the matter in the end is that we all about, restoring the dignity and the humanity of those, who have been, adversely affected by the work, and strategies of big tobacco. And those are the folks that we got to organize, around that. So So programs are fine, but it's got to result in systemic change. And to get to systemic change, we got to, connect programs with policy. And as Kristina said, that's where the organizing then, comes in, as we organize, and mobilize. The final thing I'll say on this, Eric, is, the whole piece around unity and solidarity. I've discovered, in the work here in South LA, that we cannot just talk about unity. We've got to learn what it means to be in solidarity with one another. And that is to say that if Manuel Pastor puts it this way, he says, when I get into a room where we've gathered, I look and see who's not there to make sure that if need be, I will probably need to be their voice. What I mean, that's what solidarity is all about. Solidarity is saying, you look, I cannot go with you where you're going yet, but go there, I got your back, and I'm gonna wait right here for you when you come back. You see, that's solidarity. So even in our disagreement, we can still be in solidarity with one another, because in the end, at the intersection of oppression, it broadens the circle of concern to then see how that oppression can then be turned into collective liberation in the work that we are called to do. For me, that's what excites me. That's what pulls me into organizing, and that's what just sustains me in it. Is how we are able to show people the light, as Ella Baker say, and once they're able to see the light, they will follow the light.
Yes. All right, let's hop into a couple questions from our audience. We've got 11 minutes left, and we want to be respectful of your time, so we're going to end promptly at 7:30. We realize that we're standing in between dinner, family time, whatever else you may have going on. And I see I got an amen. Amen. So I'm going to go to the first question that I see here in the chat, and that is from Gilbert Mora Jr. For any of the panelists, how do you see the intersectionality of marijuana and tobacco when it comes to social justice, especially when marijuana legalization was framed as a social justice issue? Who would like to answer that?
Yeah, I'll quickly go, and I won't say much about this. When we I was one of the faith leaders who supported the legalization of marijuana because of its, on the one hand, its medicinal, benefits, because I, had members, right, that I had to deal with, around that. I've worked with, individuals in the LGBTQI community, and those who've been, infected with and affected by HIV/AIDS, and I've seen what, marijuana, can do as it relates to, the pain that folk are in, and the comfort that it brings, to them. But I want to be honest with you, given where we are right now, right? Framing it as a social justice issue for me was a front, because a lot of BIPOC folk are shut out of that industry right now. You see, and so we just need to call it what it is. That's not solidarity, right? Don't front, that I'm going to be in, right? And when this, thing passes, and then, I go ahead and do what I got to do around this. So I think we just have to be very, very, clear around this. I believe there is a very important connection, around this, but, statistics has shown us around how, it can be, medicinal and all of that. But, we all know that one way that tobacco works is it'll take something, and again, manipulate it, turn it around, into that which destroys and into that which is destructive, around that. And that's why I appreciate Jackie always reminding us around, our indigenous people's understanding of tobacco, right? That's why I say commercial tobacco, because I know they are, and I know at some point she's going to teach me some more about it. But I mean, I think we need to be clear. That was a front. I am deeply disappointed in where that movement is. I work with Akili and others to work with pastors, around, how to, bring them on board around the truth, in terms of that. And then, in the end, it just became a big sham, and it was clear that it was, more for capitalism and commercialization than it was for social justice.
If I could add to Reverend Sauls, one of the things is that only 4% of businesses are Black in the whole industry. And so the rest are mostly white. And so what you could see is that although the African American community and other communities of color suffer more incarceration, as well as stigmatization over the use of marijuana, these communities are not benefiting, from the profits that come with it. Many of our brown communities are helping to grow the marijuana in agricultural fields, and in other ways to fuel that industry. And the profits that come back from it are not coming into our communities. And I think that's part of what Reverend Sauls is referring to. In addition to that, we have other issues that we need to think about when we're thinking about marijuana. One is we have one of our projects is called the Triangulum, and it's funded by the TRDRP, and really explores in multi-unit housing the use of marijuana along with tobacco and vaping. And what you're seeing is that some of our communities are still much more engaged in those kinds of activities, although we don't always know any potential effects that the combination of different products might necessarily have. And so still our communities are suffering, the sort of the short stick type of thing, where we're not really, we're being impacted by the use and not necessarily benefiting from the positive aspects that have come out of that. And yes, we have, I think it's like 33 states that have legalized medical marijuana, and only about 11 that I believe have sort of made it just general marijuana legal. And so I think the movement is there and will continue. And it is something that we need to be very watchful in terms of tobacco from all ends, both from the health impact as well as from, both positive and negative health impact. I'm not saying all the impact is negative. There's been some very positive health impacts as well. And really trying to understand also the combination and the use of multiple products, including tobacco with marijuana and vaping, which I think is something that we need to really look out for in our communities, especially some of our communities of color, where that use is much, much higher. And yet, then, you have these other states that are where it's not legalized, and still many of our African American and brown communities are being incarcerated because of use of this product. And so I think that there's some very serious issues still ahead to consider.
I just have a quick thing to add to that. I think I struggle coming from my community to really frame it as a social justice issue, but what we've come to and landed on is that what it speaks to the young people in our environment of, the argument usually is commercial marijuana profits. and the revenue it'll bring into our communities. And it's that time and time again, the prioritization of profits and economics, and then the neglect of other issues that are important to our community, like the health of our youth and preventing them from getting onto substances, the mental health resources that are severely lacking, that are, every issue that we can talk about in different lanes, nutrition, physical activity. And it just goes back to that the message we're sending to everyone is we value the profits more than we do the actual health of our community. And I struggle with Reverend Sauls to really use that health is the focal point of a lot of these movements, when really I view it personally as profits. And, that becomes itself a health issue because of what it's neglecting to address time and time again. Of tobacco is profits and neglects health. So one day I'll be able to frame that better, but right now that's what it's speaking to our young people.
I appreciate that, Kristina. Well, I am getting the signal from our organizers that we need to wrap up. So there are still some questions in the chat. What I want to commit to on behalf of the center is that we have the names of the individuals that submitted those questions. So we will get someone to respond and get an answer to you before the week is up. Can't thank you all enough, panelists. You all were incredible. I hope we're able to do this again at some point. I mean, this is one of those discussions that you just kind of, I wish we had another 15 minutes or 30 or 45 or an hour. I mean, really incredible conversation. Let's do this if we can pull that PowerPoint back up real quick. And we've got one quick action item. Want to remind you all to click on the social media button and post something on social media today if you can. Do that even now, something that you enjoyed about the conversation, something you took away. And again, like I said, panelists, thank you so much. If we can, as an audience, pull out your best reaction, the thumbs up, the clapping hands, the celebratory hat, whatever it is, just to let them know how much we appreciate them, their expertise. And then finally, as we close out with a minute left, we have a full day of activities for tomorrow. I want to again thank the center staff, the planning committee, everyone else who's been a part of tonight and the next couple days. We're going to start at 9 o'clock tomorrow and look forward to seeing you for day 2 of our virtual day of action. And I think I am ending with about 15 seconds to spare. So thank you all so much. Have a great evening, and we'll see you in the morning. Take care.